Hey MVPs, welcome to the broadcast. I am Dr. Zarinah, also known as Dr. Z, and you are watching Rebound Your Health TV with Dr. Z. Today we're going to discuss 12 tips to help you with your nerve pain and help to reduce your nerve pain, tips on how to prevent nerve pain, and what goes into nerve pain and why are these things going to be helpful for you today. If you don't have nerve pain, maybe you actually know someone that does, and that's why this broadcast today is going to be really important, because every pain that you have or every pain that you hear is not all created equal, and they don't all respond to the same treatments. So it's extremely important to kind of first have an idea and understanding of nerve pain, and then we can obviously better help and optimize your health and optimize your symptoms to make sure that you can have improved function and have ultimately pain freedom. So that's my segue to let you know, if you don't know me, I am Dr. Zarinah, also known as Dr. Z, your integrative sports medicine physician. I am a specialist in integrative pain management, and I help you and people like you to help you rebound your health and ultimately attain pain freedom through my concierge practice, telemedicine services, speaking engagements, and broadcasts just like these to help bring healthy tips, also bring you treatment options, some that are known, some that are not as well known, to help you ultimately get to your next. And I want you to know that also now we are offering a free, no obligation, free consultation, a 15-minute virtual office visit, so to help you discover, almost like a discovery session, to help you, and we can get you to your next, to help you get on a path so that you can get on the right path to get to your next, and that is ultimately pain freedom. You can schedule that appointment or inquire about that appointment by emailing us at info@drzarinah.com. That's info@drzarinah.com. That's DRZARINAH. So once again, thank you for joining us today, and let's jump right in. First of all, nerve pain is a big topic, and the reason it's a big topic is because even in the medical field, quite frankly, I think it's still a little bit misunderstood in terms of what's the best way to approach it. And sometimes I think that's because our toolbox, if you will, is a little bit limited, at least the mindset and how we're treating pain. And then everything doesn't fit all. So if your toolbox is somewhat limited in trying to affect change in that nerve pain, then you're going to leave out a lot of people who that nerve pain doesn't fit quite in that particular toolbox. And so you got to have more tools available to try to help people. The other piece of that is, of course, you as an MVP being available and ready to receive what you really need to do that. Because on one hand, it's definitely on us as the medical field to bring that information to you, bring the different options to you, and then it's up to you as the MVP of this whole team, actually, not me, but it's you to show up and be ready to receive it and take us to the next level, because we're going to help you get to the next. So let's jump right in first of all. So first of all, what is nerve pain? Nerve pain is a conundrum of different symptoms, and it looks and feels differently for different people. For some people it's burning, for some people it's sharp, for some people it's dull, some people even it can be achy. Sometimes it's a numbness feeling, sometimes it's a tingly feeling, sometimes it's burning. These symptoms are very, very variable, and depending on the person and also the cause. And then it can be very variable also because of the cause or the duration or the severity of that nerve pain, which is why that gets me to my next point. When it comes to nerve pain, sometimes our treatment options are going to vary depending on how long you've had the nerve pain and the cause of that nerve pain and how severe that nerve pain is. So one of our jobs is going to be definitely at REBOUND Sports and Rehab, under my care, is going to do a comprehensive assessment to determine your history. We're going to look at a very thorough history on you, and some questions that you've probably never even been asked before, because you're kind of like, what does that have to do with anything? But that goes back into our holistic approach and our integrative approach to treating your pain, because we know that pain is not one-dimensional. It comes in, it's extremely important for us to understand you as a whole person, what's going on in your environment, what's going on at work, what's going on at home, what kind of mind state and things like that play a role into it. What are you eating? What you're not eating? How are you sleeping? How are you not sleeping? All of these different things play a role, believe it or not, into your nerve pain, in terms of what's going in your body, what's coming out, what's not going in, what's not coming out. All right, so let's jump right into that. Next point that leads me into discussing the importance of, okay, we're talking about the history, importance of the history, as well, of course, the physical examination is going to be extremely important. And then some of you come to me that you've already had some different nerve conduction studies, you might have had some imaging done. I want to see those images, not just the reports. I want to look at those images on a disc of some sort. And if you haven't had it, we will determine in that comprehensive assessment if we should be doing some things, some further studies to make sure that we're going to get the best diagnosis for you, and ultimate diagnosis would then we can help deliver a best treatment plan and treatment program for you to get you to your long-term success of nerve pain relief. Okay, so that's extremely important, and that's kind of what we're looking at in the beginning. Again, so we just talked about the symptoms, we talked about some caveats around that, and then another piece of that is what causes nerve pain. Nerve pain can be caused by a variety of things, and that also goes back to my point why you can't just choose one thing or to pick one thing and that's going to be the reason why you how you treat that pain. You have to make sure that you're really considering what caused the pain in the first place. Sometimes it can be trauma, okay? Sometimes it can be some injury that wasn't necessarily traumatic, but maybe it was a repetitive use type of injury that can be pressing on those nerves, and that can cause nerve pain. Example, that might be carpal tunnel. You also could have neck and back pain that preceded the nerve pain, and then not the constriction of the spine is causing pressure on the nerves. You also can have what we call chemical or metabolic reasons why you have nerve pain. The chemical reasons such as chemotherapy or radiation, or even a chemical burn, things like that, that can cause nerve pain. And then also, as we just talked about metabolic reasons, you can have diabetes that may be a cause or reason for your nerve pain symptomatology. And then peripheral vascular disease as well. So those are really, really important. And sometimes even vitamin deficiencies that you don't really realize that that's actually playing a huge role, if not the primary role in some instances, of why you have nerve pain. So sometimes it can be just as simple as replenishing your body with the appropriate vitamins that are responsible for nerve health to relieve your nerve pain. I've actually been privy to that in a lot of cases. So that's why, again, I say it's extremely important that we realize that, and I understand that the one size doesn't fit all. All nerve pain is not created equal. So that means we don't treat all nerve pain the same, okay? Hence that comprehensive assessment at Rebound Sports and Rehab is extremely important. And as your integrative pain management specialist, that's exactly what we're gonna do. Do a very comprehensive workup to make sure that we get you to the right, key points of what is actually causing your pain. So number one, getting into our 12 tips. The first tip I would say is some basic things. Let's get some basic things out the way. If you're a smoker, you need to quit smoking. I know it's like, no fair. I don't smoke a lot. I hear that a lot of times. I'm chain smokers or just a social smoker. I've heard all these things before, and yeah, it may vary, and you may impact the severity of your pain, meaning like you may not be as severe as it could be if you was a large, smoked more packs a day. But nonetheless, if you're a smoker, if you're a smoker and you have nerve pain, you want to quit, because what's happening with the nerves when you are a smoker, regardless of if it's 10 packs or 2 packs, is that it causes vasoconstriction instead of opening those vessels up, which means the blood flow to those nerves cannot get there, which means you're going to cause increased inflammatory responses of those nerves. You have this chronic inflammation that's going to occur, and you're going to have continued nerve pain. So even if you're doing a lot of the other things that I'm going to be talking about a little bit later in this video, in this broadcast, even if you're doing some of those other things, but you're still a smoker, you're kind of shooting yourself in the foot, and you're fighting yourself in terms of getting to your optimal goal, which is pain freedom. Okay, so the next thing, number 2, would be quit or minimize your drinking alcohol. And I know people hate me for that one, maybe, right? I have a lot of people that I know, they're not necessarily alcoholics. That's not really the point. If you are, you definitely want to try to get help, or if you know someone is, definitely talk to someone or talk to your medical provider to try to help you get some assistance with that. But even if you're drinking regular a day, or drinking every day or every other day, the recommendation that you'll hear probably various different medical societies would say less than 4 drinks a week. My goal for you would be 3 drinks or less. But then you say, what is 3 drinks? Is a 40 ounce a drink and I could have 3 of those? No, that's not really what I'm saying here. What I'm really saying is a drink, for all intents and purposes, when we say drink or you hear that general term, a drink, is 6 to 8 ounces, quite frankly, right? So if you say I want you to be drinking 3 or less, and if you can do none, that'd be great too. If it's super sporadic, like once a month, you may have a drink. A drink is about that, like I said, about 6 to 8 ounces. So less than 3 or 3 or less drinks a week is going to be in that 24, definitely less than 30 ounces a week. And that'll, if you're drinking more than that, more than 30 ounces a week, you know that you're definitely going to probably be in that category, that your pain is exacerbated because you drink more than 30 ounces in a week. Okay, so that's number 2. Number 3 is exercise. Exercise is extremely important. You may say, well, exercise, how can I exercise if I have this pain? Every time I move, I'm hurting. Well, gentle, okay? And of course, don't start any specific routine without first talking to your medical provider. You shouldn't start anything new per se. If you're under the care of a provider, you definitely want to discuss that to find out what is the safest way to approach these new things. And if you don't have a medical provider, please do get one because you need that support. You need that support, someone that you can trust. And again, we're available, of course, at Rebound Sports and Rehab. Our contact information I'll give at the end of this broadcast. So exercise is important. You want to do something gentle. The purpose of that and the reason for that, why it's going to help your nerve pain, is because it's going to, once again, talking about vasoconstriction, is going to open up those vessels, allow blood flow to come into the area. As you guys heard me all before, doctors are always telling you guys, blood is life. So that's extremely important, blood flow to that area, to bring all of those healthy immune responses to that area, to bring back health to that nerve, which is in turn going to help reduce your pain. Okay, so that's extremely important to understand. And that was our number 3. I'm going to be looking down just to make sure I get the numbers right. So anyway, that's our number 3, okay? Then we talk about, along with that exercise, I would say sexual, sex, basically healthy sex with your spouse would be actually helpful too. Why? Because it also improves blood flow. Okay, so believe it or not, that can be very beneficial for other reasons too, because it also increases the endorphins, and endorphins in turn is going to be very helpful as well. So this is extremely helpful, and sometimes people avoid exercise, they avoid sex with their spouse because they're having pain. And what I'm here to say is, gentle exercise, increasing the blood flow, can be very helpful in increasing the endorphins as well as the blood flow to those kind of otherwise toxic nerves that are going to be causing you pain. So, and it can, be very beneficial. Of course, and endorphins when it's in helping to improve your mood and improve any anxiety type of symptoms. That actually anxiety exacerbates our nerve pain, believe it or not. We actually have science to support that as well. So that's why I'm saying all of these things combined together are going to be very helpful, okay? And again, if you guys have any questions, because this is a recorded broadcast, please don't hesitate to leave those questions in the comment section, and we definitely will be getting back to you within 24 hours or less, because I want to make sure that I'm still answering the questions that you guys need. We'll be back to our regular live broadcast next week on Sundays at 5 or 5:30, which will be we'll guys give you some notice to make sure that you guys can tune in. Okay, so we're moving on in. That was the 1, 2, 3. Now we're down to number 4. We have another extremely important thing is our vitamin. And if you're deficient, we talked about that a little bit at the beginning of this video. A vitamin deficiency can be extremely impactful with people's nerve pain, and in particular with B vitamins. B vitamins are very, very powerful in terms of being extremely important for the health of your nerves, and in particular things like B1, B6, and B12. So essentially, I mostly tell people take a really great B complex if you're someone that has nerve pain. Now the caveat of that is that sometimes you have to be careful if you're on other medications that could be interacting with that, depending on the level of the vitamin B that you're having. You want to make sure, again, you just consult your physician to make sure that you're on the appropriate dose that's going to be beneficial to help with your nerve pain. But all in all, for the most part, again, these are essential vitamins that your body actually needs. You do need them, so you just have to make sure what is going to be the best dosage and the way to take it for you. But if you're deficient in it, absolutely need it. So it's extremely that you identify like I said, a great vitamin B complex that can be helpful to helping, and it's going to help reduce your pain. Again, helping reduce your nerve pain. If you're deficient in vitamin B12, B6, B1, you're going to have exacerbated nerve pain. Okay, so that's extremely important. Other vitamins such as vitamin D, which we've talked about, vitamin E as well, and zinc, these are also very, very imperative or essential for our nerve health. So we want to make sure that we are getting those in our diet, either in our diet or you have to supplement it. Okay, so that's extremely important, guys. I can't stress that enough, because sometimes what we forget is that if, we kind of go on about our day, we eat our normal whatever. Sometimes a lot of us get into the habit of just eating the same things all the time. You might have a mix it up of 2 to 3 things, but then you forget that you may be missing some nutrients that are actually impacting the way you feel. Not because you're eating badly, because you might say, wait a minute, Dr. Z, my diet is healthy. I eat baked all the time. I don't eat fried. But I always question people and tell them, when you look down at your plate, how many colors do you see? That's a little tip I would say that is actually helpful to make sure that you're getting enough variety, because when you improve the variety of that, the colors on your plate, that means you're also improving the variety of vitamins and minerals that you're getting into your body. And every day that you eat, every meal that you eat, you want to make sure that your plate is fairly rainbow-like, okay? Purples and oranges and red colors, yellows, brown and beige are not the favorites, right? Because typically brown, beige, and white are our high carbs, simple sugars, and so they're not the ideal. You definitely don't want a lot of that on your plate. That should be the smallest thing on your plate if it's brown, beige, and white. Those are just some simple tips, okay? So just thinking about that when I talk about vitamins in general, how you get into your diet, but particularly for nerve pain and specifically, guys, vitamin B complex is extremely important. You want to make sure you got that into your diet. Food that is rich in zinc, or supplementing with that as well, okay? And then getting into another, I guess you could say, substance or compound called GABA. And some of you may have heard of gabapentin, but that's in my complex of my supplements, because GABA is something that is not necessarily naturally found in our natural foods per se, but is more commonly found in our fermented food, and is not as readily available across the blood-brain barrier in supplement form. In its natural form, when it's made in the body, of course, yes, which is why you have things like gabapentin, you've heard of, and Lyrica, that work on the GABA receptors. But if you can naturally get that into your diet, that can be effective as well. But again, always say, consult with your physician when you want to introduce these things. Under our care, we're very careful about and very specific about identifying, yes, this is good for you, this is not good for you, depending on your medical history, your medical state, and we get you, the best regimen, so to speak, for you, okay? But GABA, fermented foods is where that is. Some just of kimchi, kefirs, tempeh, those kind of foods are fermented, and they have richness in GABA. Another thing is flavonoids. And why would I say flavonoids can help nerve pain? The reason is because they actually enhance the production of GABA and the potentiation of GABA. And so if you don't have a lot of fermented things in your body per se, you can still eat a high flavonoid diet, such as berries and citrus fruits, that are going to impact the release of GABA, which in turn, when the GABA can bind to those receptors, it's going to help your pain. So hence the nerve pain, okay? So that's kind of the science behind that. I love educating you guys about the why. Why am I eating this purple thing versus this red thing versus not eating this and giving that, okay? Those things are extremely important, because it empowers you to truly understand why the nerve pain is there and how you can help impact it, because you're the MVP. Remember, you have to take hold of that. We don't want the nerve pain to control us. We're going to control it and manage it and reduce it and reduce it to get you to your next and get you to your pain freedom. Okay, so it's extremely important. That was our last tip. So let's see where we are. 1, 2, 3, 4. Now I'm back to our next tip, which is essential oils. I love bringing those and flowing those into our treatment plans and regimen, because sometimes when we have flares or you're just at a verge of your nerve pain increasing a little bit, sometimes essential oils can be very, very effective fairly quickly, like within minutes. And some of the well-studied ones that are actually out there, that's the common person actually I feel like still doesn't quite know a lot about, is arnica oil, as well as peppermint oil, and then even capsaicin as a cream or a gel, generally. And capsaicin comes derived from a cayenne pepper, which is that substance in there that kind of heats up. And I'll give a caveat with the capsaicin, at least, is that it does heat up, and so you want to be careful if it's on your fingers to make sure that you don't put your hands in your eyes, on your face, or any oral cavities or anything like that, because it can really heat up and potentially be dangerous actually if you get into your eyes. So I always tell people, put it on and wash your hands, or if you put it on a particular part of your body, don't jump in the shower within 20 minutes, because your pores will be open. Because why? Is opening up those vessels, which is what you want for that area. Some people have a low tolerance for it, so just be gentle with it before you start increasing how much you're putting on there. But it can heat up quite a bit. But it has been a lot of studies that's shown that people who use it, even though it does heat up quite a bit, it can be a bit uncomfortable for some in the very beginning. If they continue to use it over a few weeks span, that they increasingly actually found the benefit. So my caveat to that is saying, with the capsaicin cream and some of these other essential oils, I would say, sometimes it's a matter of you using it for a few weeks before you find the biggest benefit. But hey, if you talk about the benefit of the essential oils compared to having to potentially take an addictive medication or a medication that causes dependence, right? It definitely could wait a few weeks, 21 days, a couple of weeks or whatnot, or maybe less for some people to get to that effect, okay? And usually, again, it's a combination of some of these natural elements that I'm talking about, because you can still do the arnica oil, peppermint oil, and be deficient in vitamin B12 or B6 and still have some issues. So you got to make sure it's the whole picture. Again, that's why I always imperative, I'm telling you guys, definitely reach out to us at info@drzarinah.com to schedule your free, no obligation consultation so we can get you to your next, because that's important to make sure that you have the right support system, all right? Because to make sure that those, when you're utilizing some of these things, that you know what you're doing, why you're doing it, and how to do it most effectively and safely, okay? So that's extremely important. All right, next one, we have 1, 2, 3, 4, 5. Next one is 6, and that's decreasing your caffeine, okay? Oh, I know, I'm probably gonna get it for that one, but decreasing your caffeine is actually extremely important as well. And it doesn't mean you can't have your 6 ounces maybe of coffee in the morning, preferably the darker the berry, the darker the better. In terms of, and what I mean by that, we talked about those creamy things, right? Use it in moderation, guys, and if you can, maybe don't do it in every cup of coffee. So your sugars, your creams, keep that to a minimum, and better yet, maybe go to the decaffeinated teas that have really, many of them, especially your herbal one base, have high antioxidants, which is actually one of our things on the list for decreasing your nerve pain, which I'll get to that in a second. But antioxidants is extremely important. So benefit of that is kind of decreasing your caffeine, in particular at night. When you're about to go to bed, try not to do that, because it can make you more restless, as in terms of that nerve pain is concerned, and make your pain a bit exacerbated in the evenings, in which means you're not getting much sleep. If you're not getting enough sleep, that means your anxiety and your mood is going to become worsened, but actually exacerbates your pain. So we do know that lack of sleep exacerbates our pain, so we need you to get some sleep. Let's cut out the caffeine. Y'all see how that little cycle worked is there? It's really important. I hope y'all caught that. Again, leave any questions or comments in the comment section below. If you have any questions, we'll definitely get to you, okay? So that was number 6, I believe it was, guys, right? 1, 2, 3, 4, 5, 6, all right? And that leads us, which is a great segue into our antioxidants. Increasing our antioxidants is extremely important in helping improve our pain symptomatology from nerve, because antioxidants are essential for the health of that nerve. And if there's that, then you have a highly high radicals, which comes from, again, our diets, or the toxicity that's coming from there, because maybe you're a drinker, or maybe the type of foods that we're eating, or we're not getting enough of other beneficial foods, then that increases the free radicals in our bodies, which is going to, of course, affect our nerves. So it's really important to make sure that you have a high potent diet and antioxidants. So that was our number 7. Did we say 1, 2, 3, 4, 5, 6, 7? It was. And number 8 was actually, I think I jumped over 8, or I added 8 into another one, which I actually have as GABA, which we discussed, but I'll touch it one more time in letting you know that GABA, as some of you may have been on gabapentin before, or Lyrica, or Neurontin. These are our GABA medications, so to speak, that are prescription strength, and that can be very effective. I've prescribed them. I find it to be beneficial for a lot of my patients, but some patients can't tolerate it. So there we have to have other alternatives. Remember, we talked about the very beginning of this broadcast is that our toolbox has to be full as specialists. And I take very, I take that personal, I take pride in making sure that my toolbox is full of information, and full of education, and full of treatment options for my patients, depending on where they are. And not everybody can do certain things. So it's like, oh, sorry, you can't take Lyrica. I'm sorry, you're gonna have to suffer for the rest of your life. Or sorry, you can't take gabapentin or Neurontin, so go take this Percocet for the rest of your life. We have to get beyond that. We have to make sure that we understand that there's other options out there to make sure that our patients can benefit the most from other options out there that, one size doesn't fit all. Okay, so that was actually our number 8, the GABA. And again, you can find that in fermented foods because they're not really naturally produced in just like an apple or orange. But some things like kimchi, tempeh, kefir, which is kind of like a yogurt-like milky substance or drink, even yogurt actually. So those are the things that can be rich in our GABAs. Okay, so that's technically number 8. And then our flavonoids, we talked about that. I actually folded that in as well. So we're kind of getting a lot of juicy here. So that was technically number 9. I'll touch on the base just to make sure we're kind of staying in order with our flavonoids, such as our berries and our citrus fruits. And even apples and pears are high in flavonoids. Why flavonoids for nerve pain? Once again, is because it helps enhance the production of the GABA in our body so that we can get the benefit of the GABA, hence increasing that GABA will help reduce the nerve pain. So we want to try to, as much as possible, have that produced in our body as naturally as possible without having to take medications, or at least minimizing the prescription medication that we are taking. So that would be great as well if you're getting that through your diet, okay? So that was technically number, 12, 11, 10. That was number 9. So that leads me to number 10, which is prescription cream combos. And so now I'm kind of getting into the medical things that you do absolutely need. The other things I still say you need a guide and support of a medical provider. Again, and we can be that for you or whatever you are in your local city or state. But those things you want support. But then the next 3 items that I'm about to discuss on this list are extremely important that you realize that you can't just grab those off the shelf. So just some of these prescription cream combinations, and I was actually talking to a group of ladies who have actually, I guess you could call it a support group, I guess you can say, for women who have nerve pain. And what I realized when I was discussing with them was that many of them have tried the gabapentin and Neurontin and such, but had never heard of or never been offered some of the prescription creams that are combo or compound creams that come that you have to have the pharmacy kind of make up, if you will. And that's actually something that I think a lot of people are probably underutilized as far as our physicians, and it may just because it's less understood. Again, that's why it is important to have a specialist to make sure that you know that you're in the hands of someone who kind of does understand those compounds. But even if it's not a specialist, our family medicine doctors can prescribe these actually. So I want you to know that your family doctor can prescribe it. Just bring it up to them, maybe have a conversation and see what, things can come up. What things you and your family medicine doctor could come up with. Sometimes it's just a matter of reaching out or them reaching out to their pharmacist and kind of coming out with the best plan. So prescription creams, combo creams, I won't go through a whole list because there's so many different combinations that will basically be determined based on the type of nerve pain you have, the cause of the nerve pain, and the severity of it is going to depend on the percentages and so on and so forth of the compounds that we put together. But that's I feel like an underutilized treatment option for some people, in particular when it comes to nerve pain, that there are some creams. Hence the benefit of that and why I like it so much is the profile for side effects or long-term dependency and things like that is like almost like non-existent, which is great. But you still get the benefit and of the decrease in your pain symptoms and having, again, being able to be more functional in your life without that dependency. So that's why I like the cream combinations for many of my patients, depending on the situation. Okay, so that was number 10. Number 11 is acupuncture. I love acupuncture because again, I'm an integrative, pain management specialist. So if I can give you options that are powerful, but with, minimal, if no side effect, then those are the things I'm going to try to make sure I get to you guys. And it's actually more out there than you realize. Look at what we've already done already. We've talked about 11 so far. We're almost at number 12 of different things treatment options that you can do to reach you to your next for pain freedom from nerve pain. And some of these you might have heard of. Many of them you have not. or maybe you did and you didn't realize that that was something you can do or should be doing, or you don't know the combination or how to, pull that into your lifestyle so that you can benefit from it. That's why I'm here. That's why Rebound Your Health TV with Dr. Z exists. Okay, that's why I'm trying to impress upon you, everyone. If you can hear my voice and you see my face, that you are the MVPs of your life. These are the things that allows you to have MVP behavior. Okay, so I love that, and it's awesome. So acupuncture, again, it can be very, very helpful. It's a ancient treatment. Quite frankly, it goes back thousands of years in terms of Chinese medicine, if you will, that has come to America over hundreds of years, definitely now at this point. Make sure you find acupuncturists that can show you and explain to you their background as far as acupuncture is concerned, what kind of things they actually treat, because not all acupuncturists are created equal, and also some specialize in certain areas and others specialize in other areas. So that's important for you to understand all of that. So just make sure you do a thorough, come in with your own questions to make sure that you feel comfortable with that particular acupuncturist, to make sure that you get the best benefit. And that way, when you buy both on the same page and you feel like a sense of like, I truly understand what I'm getting and what I'm gonna feel, what to expect, you're usually gonna do a lot better with that treatment. So that's important too. Acupuncture for nerve pain can be very, very effective, guys, okay? And last but not least, one again, underutilized. So I kind of use the underutilized things toward the end to make sure that maybe that'll be the last. All of these things are important. All of these things that I've just mentioned are going to be extremely beneficial and very helpful. But the underutilized things are kind of want to make sure that left the last impression, so to speak, on your brain, that you absolutely remembered. If you got to the end of this video, then that means you definitely was interested in trying to understand all of the ways that you could maximize the benefits of decreasing or minimizing, if not eliminating, your nerve pain. So kudos to you, MVP behavior, once again, if you got to the end of this video, because you're ready to go at it, and we're here to help you. So number 12, last but not least whatsoever, definitely not least, is regenerative medicine, something that we call neural prolotherapy. And that's Neural, Prollo, therapy. Okay, and what is that? That's a regenerative medicine treatment that is actually very natural in its base. We use a little diluted substance, dextrose solution with some normal saline and some bicarbonate that actually causes about the size of an acupuncture needle. It's very, very small, guys. Nothing to be write home about whatsoever. And we just under the skin surface, where those nerve pain symptoms are expressing themselves, is where we put that substance. And a lot of times, guys, I promise you, like, not for every single person, but it's definitely not uncommon for you to walk out there before you leave the office and already having that relief that you hadn't felt in years or months or whatever the case may be. If it's appropriate, again, comprehensive assessment is very, very critical because we have to make sure that it's appropriate for you. But when it is, in many cases for certain types of nerve pain, including even fibromyalgia, some of my fibromyalgia patients actually have this kind of nerve type of pain, and they've responded very well to this neural prolotherapy. So that's important for you to know as well if you're having some of those symptoms. And what happens is essentially it's affecting what we call, the studies at least believe it's affected, because it's still, the studies definitely supported in terms of clinical studies. But in terms of, again, medicine is always evolving, understanding what exactly is the exact science. But what we do understand, what we do believe that is affecting these peptidergic sensocrine nerves, fancy words, maybe some of you care, maybe you don't, but if you wanted to look that up, that's what it was, affecting those nerves to decrease that kind of chronic inflammatory response that's happening there. Because when the nerves get inflamed, they release these things called substance P and CTRP, which is these inflammatory substances, and we want to calm those down, calm that reaction down, and that's how we can do it through neural prolotherapy. So it's a really exciting field, actually, helping a lot of people. I get so much pleasure out of helping you guys, and when you kind of right there along as an MVP, getting you to your next. And that's a particular treatment that is out there that is a little underutilized, but it's also very specific to only certain specialists know how to do it. And we do provide that for you guys if it's appropriate at Rebound Sports and Rehab. So that's it. Those are our 12 tips. I hope this was beneficial to you or someone else. If it was, even if you want to catch someone on replay or you had to push pause and come back to it later, don't hesitate. Just come back to the video to make sure that you get this information, because it's really, really important for you to make sure that you know you're empowered with information to know how can you help yourself or one of your loved ones that you know that are suffering with nerve pain, okay? So you guys know me. I'm going to sign off now. I'm Dr. Zarinah, also known as Dr. Z, your integrative sports medicine specialist, your integrative pain management specialist, to help you rebound your health, get you to your next, to help you ultimately reach pain freedom through my concierge practice and telemedicine and speaking engagements and TV shows just like this to help you get to your next. You can reach out to us with no obligation, free consultation, virtual office visit, 15-minute visit where we face-to-face virtually can get you a discovery session to make sure that we can figure out how to help you get to your next. And you can do that by emailing us and inquiring at info@drzarinah.com. That's info@drzarinah.com. Dr. Zarinah spelled DRZARINAH.com. See you guys later. Thanks for watching.